Right. All right. So, guys, we will begin the session now. So, hello, everyone. A very warm welcome to all of you joining us today. Right. So, just to give you, or since we have some new faces here, just to give a small introduction. Right. Give me 1 second. Right. All right. So, for the new faces, right? Welcome to Medicine 101, right? It's been almost an year since we started the Medicine 101 lecture program since September 2020. And we've had a total student body of about 400, right? Added to it the free sessions like the one we're having right now. And we've completed a total of about 350 teaching hours, right? Of course, spread across different lecture modules, right? So for any newcomers joining tonight, you can learn more about our programs from our web portal, right? So the links will be posted in the chats. Now, folks, across all of our lecture modules to date, we have included bonus sessions, right? We've had a couple of sessions named Beyond the Books before, right? Where we invited a doctor to come speak about his personal experience working in the government sector of Sri Lanka, right? We had a research psychologist come in to talk about how to do our own research, right? And we even had a TEDx speaker coming to talk about the evolving field of healthcare, right? And then we decided to host this new series of sessions called All About Licensing Exams. The main reason behind that being that a lot of students messaged us, right? Saying that they wanted to know what options they had open for them, right? Within this medical field, right? In their careers. So with that in mind, we had the first session about a month ago that was all about USMLE, right? And today we have the second iteration of this project, all about PLAB. Now, let me introduce our guest for the evening. We have with us here today, Dr. Delysze Oorloff, right? Dr. Delysze is a past pupil and an outstanding one at that from Nanjing Medical University. She was awarded a number of scholarships, including Jasmine and Nanjing government scholarships during her study, right? She also happens to be great at managing extracurricular activities, basketball, hiking, drama, theater, all of that, right? So just to give you all a timeline, Dr. Delysze graduated from NMU back in 2019, right? She sat her PLAB 1 in March 2020, then PLAB 2 in December 2020, right? So after acing these exams, she has been a GMC registered junior doctor in the NHS since January 2021. She's currently a junior doctor working at Ashford and St. Peter's Hospital NHS in Stanwell, England. All right, so we will begin the session shortly, guys. Just a reminder, try to keep your cameras on, be interactive. If you all have any questions, you all can send in the questions in the chat box. And towards the end of the session, we will have a 10-minute Q&A session, right? So without any further ado, let us welcome Dr. Delysze Oorloff for tonight's session. Dr. Delysze, the stage is all yours.
Right. Thank you for the introduction, Prashant, and thank you for the opportunity for having me at Medicine 101. Let me, give me a second, I'll share my screen. And hello, everyone who's joined today. Right, so like Prashant said, I am one of the junior doctors working in the NHS at the moment. I'd like to get to know you guys a little bit more. So could you guys let me know in the chat, has any of you like attempted PLAB at all? Okay, no. Anyone here who's attempted PLAB? Okay, fine. So, and could you also quickly let me know what years of university you all are in? Is it the first year, second year, fifth year, waiting for internship? Right. So we have first, second, third, fourth, fifth. Great. So I'll start my presentation soon. Good to know that we have a vast range of students. So let me start. So talking about PLAB, I'll just give a basic introduction and go into depth so that we all are in the same page. All right. Great. So speaking about PLAB, right. So the best way to describe PLAB is it's a professional and linguistic assessment board exam, shortly called the PLAB test. It helps the General Medical Council, that is the regulatory body in the UK, make sure that doctors who are qualified abroad, that is outside the UK, they make sure that they have the right knowledge and skills to practice medicine within the UK. So this is just a licensing exam, and it's not a medical qualification, it's a licensing exam. So that's just to make sure that we're all in the same page. This is what PLAB does. It gives you the license to be able to practice within the UK. So I like to, most of the time when speaking of PLAB, it's good to know the general overview of what you need to do from the time you're in university to start working within the UK. So this is my little flow chart for you guys. You first start by making a GMC account. Then you have to prove your eligibility of your language proficiency. That is, you either doing OET or IELTS. I will be going into depth of each of these topics. So this is for a general overview. Then this would allow you to do your PLAB 1 exam. So I will be mentioning this again later, but I'd like to emphasize that to book your PLAB 1 exam, you need to make sure that you have a language proficiency to do so. So you need to upload or submit your OET or IELTS results. Otherwise, you won't be able to go forward with the steps. So in general, most of these steps follow one after the other. So you first make your GMC, then you do your OET or IELTS. And once you have the necessary, if you meet the necessary criteria, you move on to doing PLAB 1, then you move on to do PLAB 2, then you need to have your certificates verified by EPIC, which is a verification body, which is mostly done online. Then you get registered with the GMC. Once you get registered with the GMC, you become a GMC registered doctor. And then you are literally eligible to apply for jobs within the NHS. So this pathway that I've taken allows me to practice as a non-trainee doctor within the UK. I know that you may have a lot of questions. I'm happy to answer them at the end of the session. So just type them in, and I will obviously ask Prashant to check with the questions and let me know what you want to know. So yeah, so you go through job applications, and once you apply for jobs, you will be called, depending on your profile and the preferences of hospitals, they will call you for interviews. And once you go through the job interviews, you will get a job offer, which will eventually lead to work in the NHS along with visa sponsorship, etc., depending on your needs. Right, I hope that's clear so far. Let me move on so let me just quickly check. Yeah, so speaking of cost, so yes, a lot of people ask me about the cost of this journey. So I have tried my best to, basically, I am not going to give you guys an overall cost because I did my PLABs over the pandemic and the costs varied vastly because I had to travel back and forth, delays in exams and so forth. But this is a general cost. So your IELTS would cost you £195 and your OET would cost you £320. PLAB 1 would be £239 for the exam. The question banks for PLAB are relatively inexpensive. So it's about £25 per question bank. It depends, to be honest. It also depends on the length of the subscription. So it's between £25 to £100, depending on the number of subscriptions you take and the number of attempts you want to do these subscriptions for. So generally, it shouldn't be that expensive in comparison. So then moving on to PLAB 2, your PLAB 2 exam will cost you £875. And your course fee for your PLAB, basically you would go through a course for PLAB in most occasions, and that would be an average of £500 to £600. The GMC registration is £153. The EPIC verification that I spoke about before, which I will be going into detail in the next slides, will cost you in dollars $230. So in addition to these costs, you will also have your travel tickets, depending on what country you're from, your visa fees to enter the UK, or if you choose to do your PLAB 1 in a different country, the visa fees, travel tickets, your accommodation in the UK and outside, during your PLAB 1, and your incidental expenses. So I do not want to give you guys a total cost, but this would give you a good idea as to how much you roughly would need. So safe to say that PLAB is less expensive and more affordable in comparison to the other licensing exams, the most common ones being USMLE or AMC. So, right. So so it's basically the incidental expenses I would like to talk about is, for example, if you go through IELTS, PLAB 1, PLAB 2 in one go, well, I hope all of you all do, that would be just one time. But there are incidents or times when sometimes you don't get the desired IELTS score, you don't just get your PLAB 1 score or your PLAB 2. So you may have to repeat. So these things add on, but these are the basic expenses. I hope that's clear. I'm going to move on. Right, so let's start with the first step of getting into the UK is making a GMC account. So you can make your GMC account at any stage. I recommend making it in your 4th or 5th year, because that's when you will be uploading your IELTS results, booking your exam. So it's more practical to get it done in the 5th year. However, it's good to know the process of how it works. So the process of making a GMC account is pretty straightforward. You go online, type gmc-uk.org. Then you come onto the screen that I've showed here. You click on GMC Online. And once you're online, you say set up your GMC Online account now. So I don't want to go into too much detail of how this is done after, because it's pretty self-explanatory, because once you log in, they will ask you your personal details, your address, your contact numbers, and the university you're from. The only problem that you may come across is, depending on what university you're graduating from, the university that you have to pick the university you're from, and it's usually a drop-down box where you will choose. For example, I'm from Nanjing Medical University, so it was already on the list and there was no issue. But I've seen instances where some doctors complain, or they have issues with the university is not found on the list. So I'm not sure what you do from here, but I know that they have done is they email GMC about it, and they've sorted it out with, sometimes it's just the issue about some paperwork between university and the GMC. So you could technically get in touch with the GMC, speak to them about it, and then contact your university and then ask them to get in touch and sort the issue for you. In most instances, even from the experiences what other doctors have shared with me, not with me, on the groups, that they said that they sorted it out, that they were able to get their university on the list, or that their their application went through. So that shouldn't be an issue, but I'm talking about generally, it shouldn't be an issue if your university is on the list. So that's about it. So you would use this GMC account. From here on, you will get a number. You'll get a GMC reference number. So that number, so make sure you remember your password, you remember your GMC reference number, because you'll be using it for life. You can technically, get your passwords back if you lose them, but it would be such a hassle. So make sure you remember your GMC number and your password. So from here on, you'll be booking your exams through this account. You will be paying for your exams through this account. You'll be getting your results through this account. And you'll be using this account for excuse me. Right. So you will be using these accounts to get your results, and in general, you'll be using GMC throughout your career in the UK for all your revalidation purposes and so forth. So this is a very important number. I mean, hold it tight. Right. So next slide, let's move on to language proficiency exam. So this is the next important step. Once you set up your account, you will come to a page where they allow you to upload your scores. So in general, for those who don't know what OET or IELTS is, this is an English language proficiency exam. It's available. You can do it from most countries. And then it's divided into 4 parts. That's listening, reading, writing, and speaking, right? And it can, this can be done on the computer. Basically, it could be done on a paper, written format, or on a computer. Usually the speaking exam is on a separated. This is a general overview. Let me go into detail. IELTS. So I personally did IELTS. The reason why I did IELTS was I was in Sri Lanka back then, and it was more freely available, which is IELTS exams takes place literally every single day. And it was relatively less expensive than OET. I'll come to OET later. To be honest, back then I wasn't too aware of OET, and IELTS was something I was comfortable with, and there were like information available readily. There are people who would speak or recommend OET, but I'll come to it when I speak about OET. So in general, IELTS is £195. So back in the day, basically when I was doing it, I think that was the year when they changed the requirement for IELTS from IELTS. Right now, you can do either IELTS Academic or IELTS UKVI. So before, it was always UKVI for GMC registration. So that's irrelevant now. I doubt they're going to change it. So, coming to UKVI was quite expensive, relatively more expensive than academic. But now, if you're booking IELTS, make sure you're booking an IELTS academic exam. The price apparently differs from the country you're doing it. So according to for IELTS, to register with the GMC, you must obtain an overall score of about 7.5 with a minimum score of 7 in each subset. So that means your average band for IELTS should be 7.5 in order to be eligible to sit for your PLAB 1 exam and thereon to work process your GMC registration. So the minimum score for speaking, writing, listening, and sorry, I missed on it. Listening, reading, writing, and speaking should be 7 on each subset. So even if you get 1 less, basically, even if 1 is less and your score is, basically it has to be 7.5. Even if one of these subsets don't come up to 7, you are not eligible to sit your PLAB 1 exam, nor are you eligible for the GMC registration. So it's important that why I'm saying this is because it's important for you to plan well on how to do IELTS, when to do it, and I think it's important as the PLAB 1, PLAB 2 exams, because this is an exam that lets you sit for PLAB 1. And sometimes poor preparation would lead you to have like multiple attempts of this exam. So I think it's important to plan well and prepare. So averagely for me, my preparation time for IELTS was actually, to be honest, about 4 weeks, where I would sit and practice every single day, get a teacher. I did it in Sri Lanka, so I had a lovely teacher correcting my essays for me, because I personally thought that writing was very difficult. So let me get on track, and I'll speak a bit more about my experience with IELTS. So I've already said this. To sit the PLAB test, you must obtain the required IELTS score of 7.5 and 7 each. So with my experience with IELTS, so just remember that these are just language, these are just skills. Although we can all read, write, speak, and listen to English and understand them, the required skill is the level required is a 7. So sometimes you might be a 6.5, and that can be disappointing. But don't worry if one of you guys, or at some time you don't get your desired score in one go. It happens a lot to doctors. It doesn't mean you're bad. It's just that you haven't developed that skill. A skill can be learned, developed, and improved. So it shouldn't be an issue. If you don't get through your IELTS in the first go, you can get through on your second or third. There is no limitations in the number of attempts. It's just that getting through it on the first go would just save you a lot of money and time. So yeah, this is about IELTS. So I personally haven't done OET, but I got some information about it. It's more expensive than IELTS, which is £320. So again, the price differs. They also test you on listening, reading, writing, and speaking, the same things. But the difference between IELTS and OET is OET is an occupational English test, and it depends on the occupation you're applying for. So for us as doctors, it would be medicine. So some doctors prefer doing OET is because when it comes to IELTS, the topics that you talk about and you're going to read about and speak about is very vast. So it could be from communication to space to traffic to health problems. So, well, I haven't got the list at the back of my head, but for example, it's very, very vast. And yeah, whereas for OET, people prefer it, although it's more expensive, is because it's very medicine oriented. It's medical terminology. You will speak about things that you will deal with in your everyday life in medicine, and you would have come across them in university during your work, wherever, if you were working, where you're working. So, so essentially OET is about like writing discharge summaries, referral letters, writing to the GP, or like asking for medical advice. Yeah, I'm not too sure about the details, but it is going to be very medicine oriented, and a lot of people find it easy. But this also requires, as to what I have read, it requires good practice and a good prep time. I'm not sure about the prep time about OET, but from what I've read so far, you need to practice well, plan well. And if I'm not mistaken, OET, they're not as freely available as IELTS, because when I was researching about it, I noticed that you get one exam every month or 2 exams a month, versus IELTS is more freely available. So I'm going to quickly speak about preparing for IELTS. The resources for IELTS, I haven't linked it here, but it is freely available. So British Council is the best place to go for in terms of IELTS, where you will get the past papers for it. So essentially, working for IELTS would mean working on past papers, working on your time management, and practicing. And if you think you need it, you can get guidance from a lot of teachers out there, and also get your writing corrected. Basically, work on whatever you are lacking, and it's definitely doable. And people eventually, some people find this whole process difficult, but it actually helps, because it helps you back. Like, for example, if your English skills are not great, then it would actually help you develop it and come up to a standard which you can work in the UK. That would help you. So this is an investment for the future. Right. So I think I spoke too much about IELTS and OET. Let's move on to PLAB. So PLAB 1 is essentially a written exam. It's a multiple well, people get confused. It's a single choice exam, right? Multiple, when I say MCQs, it's like you had this single best answer. It's made up of 180 multiple choice questions, which you must answer within 3 hours. So during the pandemic, this kept changing. So when I did it, it was 180 in 3 hours. But then, well, I'm not sure what's happening right now, but I think the last time I checked, it was 160 within 2 hours and 45 minutes. Anyway, they changed it because they didn't want people to stay in a room for too long. So this will be the least of your worries, because whether it's 180, 150 or 200, you will practice for it, and it shouldn't make a big difference. It covers the topics, skills, and procedures that a doctor who passes the test would need to know in order to be able to show that they have the professional qualities expected to work in the UK. So this is £239. It's paid, like I mentioned before, paid via the GMC website. After and only after you can book a valid, after you have uploaded a valid OET or IELTS test. Right. So I hope it's clear so far. Again, if you have questions, type them in and I'll answer them at the end of this session. All right. Right. So moving on, so what is tested in PLAB 1? You are essentially tested on your medical assessment, how you assess a patient, how you manage a patient, and in general, your knowledge and experience. So most of the time, it's an equal balance of the three. I'll come to how you can get a good idea of the exam in the next slides. So about passing the PLAB 1. So the score to pass PLAB 1 is not always the same. It can change on the average score, but it's always around 120 to 126. So this is averagely like 60 to 62%. It depends, I believe it depends on how people perform on the day, right? So I will be speaking about my experiences with PLAB 1 exam. So just remember that the most important thing is how you utilize your time on the day of the exam. So the next most common questions I've got is, where can I take PLAB 1? So like I said before, once you get registered with once you make a GMC online account, then you upload your IELTS results and you move on to booking your PLAB 1 exam. So the thing is, you have to plan well. Where do I want to take my PLAB 1? So PLAB 1 is not available in all countries. For example, it's at the moment, or at the last time I checked, it's not available in China. Yeah, so these are a list of countries that PLAB 1 is available in. That's like Australia, Bangladesh, Canada. So if you happen to be in any of these countries, I'd advise you to plan ahead so that you can book exams in these countries. But unfortunately, it's not always the case, because there could be seats not being available, or the exams sometimes don't happen. So I'm from Sri Lanka, and when I wanted to do it in Sri Lanka, it wasn't available because of the political situation. So I chose to go to the UK. But yeah, so these are things that you can't control, but having done your IELTS early and having the luxury of booking early would give you a good choice of where you want to do. It could help you save some money, like travel costs, accommodation. And it could actually, knowing early would help you like plan ahead. So this is all good. Yeah, moving. So where can I take PLAB 1? You can find, so basically these are just a general list. Always confirm where you can take it on the GMC account. So once you upload your results for IELTS, you are able to book an exam. It would give you options along with the closing date. So, sorry. Sorry. So the closing date for outside the UK is usually earlier, about 8 weeks earlier than the UK. So if you want to do your exam, again, you can verify this on the account, but I'm just saying, if you want to book your exam, sorry, I lost my trail of thoughts. So let me just come back to, yeah. So if you want to book your exam early, it's best that you, if you want to book your exam outside the UK, then you need to plan ahead and book these exams, or keep an eye on the account to see if your country is coming up. But if you want to go for the exam and have certainty, I'd recommend doing it in the UK. It obviously comes with costs. Right, so let's move on from here. So when can I take PLAB? So these locations that I mentioned here are not always available throughout the year. The only place where it's available throughout the year is in the UK, and it happens 4 times a year. That's March, June, September, and December in the UK. But over the pandemic, the GMC has also allowed students to take their exams from these countries. This may change in the future, but may not change in the future. But generally, you can look out for PLAB 1 exams in March, June, September, and December. For more information, I will make these slides available for you, so you can go on the link and read more about where and when you can take PLAB 1. So moving on. Okay, so this is the question I chose to answer here, although this is a gray area, is because a lot of people ask me now, depending from where you are now, most people are worried about, obviously, most people can't do their internships. You'll have a lot of time in hand. So doing PLAB 1 is a very good option, but that comes with a gray area, which is unclear. So this is what I found on the GMC website. So before taking a PLAB exam, this is what you must have: an acceptable overseas primary qualification, But if you have not graduated yet, we will need to confirm that you have passed your final examinations and are eligible for the qualification. The necessary knowledge of English and a DGMC online account, which you would have, obviously you would know about the English language before you book your PLAB 1, GMC account is sorted. So I don't want to encourage any of you guys to go forward and, do IELTS and book PLAB 1, because I know that once you you can open your PLAB, I know for sure that you can open your GMC account early. You can upload your IELTS qualifications early during your internship year or even your 5th year. But regarding this acceptable overseas primary qualification, I suggest that you guys email GMC. You can find the email address on their website. If you can get the primary medical qualification or your diploma at the end of your 5th year before your internship from your universities, you can get that. And I suggest or urge you guys to directly confirm with the GMC if this is acceptable, or like find out if you can communicate with university to get them to confirm that you are eligible for the final qualification and you can't get through to your internship because you have obviously restrictions due to the pandemic. So this is something that I think would be best, because it's a gray area and I haven't come across someone who's done this, and it's best that you find out directly from the GMC, and they're very helpful. They will be able to answer any question or guide you in the right direction so that you all have that security that yes, I can go forward and book my PLAB 1. Because the issue is, although even if you do book, if this comes into account in a later time, that when you did your PLAB 1, you were in fact not eligible for the qualification, although you passed it, they hold the right to deny your exams or cancel it. So you don't want to get into that area, or that it's just complicated. So best is to clear it off before you start, right? Okay, so this is it. This is my general advice to those who would, I'm assuming, would ask me if they can do PLAB 1 during their internship year or before, just after their 5th year. That's after you finish your final 5th year, after you finish your diploma, right? Move on. So how I prepared for PLAB 1. So you can use different resources. So the books I suggest would be Oxford Handbooks of Clinical Medicine and Clinical Specialties. This is it's very concise, it's easily available, and it has summaries of the kind of information you would need when you actually practice in the UK, and the way to approach a patient would also be able to, clarify your doubts. In addition to this, I also use something called PLAB 1 keys. So this is the link to it. So this is basically a group of doctors who've, okay, let me come back to that in a bit, and also use question banks called PLABable. This was my first choice. And there's a question bank called Past Medicine, which you can use as well, and mock exams. So speaking a little bit on in depth. So I think from the experience of doing the exam, I found PLABable the closest. I practiced on PLABable. I did my questions. I was able to revise from it. I think I did it about twice. And then I also used PLAB 1 keys to reinforce the knowledge that I got by doing PLABable. So it worked for me because I wasn't too keen in making notes. So PLAB 1 keys is essentially or literally the same explanations from PLABable, but written down in a really concise, attractive way that helped me grasp. I've never really studied off online resources before, but this was really good for me because it saved me time from making notes. But this is just my personal approach, and that worked for me. This is what I did, but it's obviously you guys are free to trial other resources available out there. Some would say PLAB 1 keys isn't the best for them because it was the same, but it worked for me. So if you're good at making your own notes, and if that's how you study, then I suggest go for PLABable, see how you work. And then if you think that PLAB 1 keys will help you, you can always get it. So the cost with these are subscriptions of about 3 months. Yeah, 3 to 6 month subscriptions, I believe. And then relatively inexpensive. I'm comparing to USMLE. question bank. So it's like 25 to 30 pounds, like I mentioned before. So the cherry on the cake for all of this, or what I'm trying to say is that at the end of all of this, like no matter what you use to revise, I believe it's important to do mock exams, because with PLAB 1, your time management is very important. Like you need to be able to, like 3 hours is a long time, but you don't feel that go, because I believe with my personal experiences, by the time I read the question and read the answers, I should know the answer. I don't know if it's because I'm a slow reader, but some people would say differently. This is my personal experience. I felt that once I finished reading the question, I had to know the answer, the tip of my fingers. Because if I didn't know, and I would get, like, you can eliminate, but you'll always get stuck at some point. So my pro tip for anyone trying PLAB 1 is don't waste time, because there are 180 questions. Your pass mark is 60%. That's about 120. You can afford to lose marks. So do not answer the question. Like, do not leave it blank. I suggest marking the answer as you go. Like question number 1 answer was A, mark A, double check then and there, because a lot of people have said that they've marked on the paper. I don't know, it depends on your reading speed. So people didn't have time to come back and check, and they've marked it wrong. So these are unfortunate mistakes or things that you can definitely avoid. So I'd suggest, these are like basically your MCQ exams you've done in uni or school, where you read a paper, mark the answer, and shade the box. So literally, you can practice doing that when you do mock exams, which are available on your question banks. So I suggest you mark the answers straight away. Don't waste time trying to think or come back to it. Obviously, if you're very sure you know the answer, but you need some time, you can, but don't leave too much of it, because most of the time you don't have time to come back. And make a good plan to revise in a way that all this information are in your short-term memory. What I mean is you're thorough with these things, because I have a lot to say. So let me say, so make sure you're thorough with these things, right? Right. So for mock exams, so mock exams on PLABable are available on PLABable itself. There are 10 mock exams. I personally tried 5 of them, and I thought I was fine. So the average score you get for these exams depend on your knowledge, right? So this will also indirectly predict the outcome at the exam, which was actually true for me. And I got this, this was recommended to me by most of the doctors who did the exam before me, and I got this information on PLAB group. So this is actually worked for me as well. That's why I'm suggesting it. So let me go on to the next slides, because I think whatever I'm going to say will be on these slides, so I'm not stuck on this slide for you guys. Right, so prep time for PLAB 1 is usually 4 to 6. So I've seen people do their PLAB exam in less than 4 weeks. Some take 6 months. I think it took me 3 months. That's recommended because I believe I was an average student. So, people would say otherwise, but I think for an average student, 3 months is good. 3 months of dedication. But this is what I suggest. But it obviously depends on your baseline clinical knowledge. So depends on your medical background. So maybe you've already read a lot and you're very thorough. But sometimes you probably wasn't the most attentive student in university, and you didn't really study well in uni. But that doesn't all matter, because wherever you are, knowing what your baseline clinical knowledge is and accepting it will help you overcome it. So it doesn't matter if you were just not the best student in uni, or you didn't take too much of interest in one subject and not the other. So it doesn't matter at all, as long as you know where you are, right? So, and obviously if you feel like you need more time, take 6 months. This is not a race. If you can get through your exam in one go, that's the best, because the score doesn't matter. You just need just need to pass to move on to the next step. So your preparation time for PLAB 1 would also depend on the time available for you to study. So for example, I did most of my studying, like focus studying, once I graduated, but I was preparing for PLAB indirectly because I had my options open back then. And I used it, if most of you guys are from China or from Nanjing Medical University, this PLAB preparation also helped me with my graduation exam. So it really helped. So I think I explored PLAB questions and the topics, and obviously all are clinical scenarios, and medicine is universal. So what the things that they expect us to know for PLAB would also be the ones that you would generally required to be you would be generally required to know for your graduation exam. So it helped me personally with graduation exams. So for me, it was like 2 birds in 1 stone. So I didn't prepare for PLAB 1 dedicatedly in my internship year, but I obviously got the question banks early, and I kind of warmed up to the idea. Whereas then I had to do my IELTS, which took me time. And then, so if I was, like Prashant mentioned, I did my IELTS in October 2020. And because you can't book your PLAB 1 exam until you finish IELTS, until you've uploaded IELTS, the next closest available date for PLAB 1 for me was in March, because there was no availability. Like there was November, but they were like countries that I didn't see myself going on my own to, or they were too expensive to go to. So I was like, okay, let me do it in March in the UK and hopefully be able to do PLAB 2 as well, because Sri Lanka or India wasn't in my practical options, right? So yes, coming back to preparation time for PLAB 1, all of these things matter: your ability to grasp, the time you have. Basically, if you're working while you're doing PLAB, are you completely free? So have a very practical approach, because it's not a race and you should know yourself better. It's also important, like there are sometimes people come up on these PLAB groups saying, look, I got 90% on my PLABable mocks, but I still failed. So the simple answer to that is, once you keep our memory, like you can actually remember the answers, because the PLABable mocks would essentially be the questions you practiced from. So it's important to grasp the main core of the question, the concept. Okay, how do you treat atrial fibrillation? What is the next best step? It doesn't matter that you remember the answer, but what's the best investigation for a mother who comes in with bleeding? What's the best investigation for the mother? Or how do you manage a mom who comes in with pain? So, this is like, it's not the question, it's the concept, the core. So if you are able to master the concepts, the core of the questions from PLABable, or any question bank you choose to. I personally did PLABable and it worked for me, but you can always do more, because I scored average. You can always score more or less. It's your personal satisfaction, but it doesn't matter. It's important to understand the core and be true to yourself, because you can always cheat during your mock exams because your time's running and you can be like, oh, I know, but so be true to yourself when you answer these questions, so all of these together will determine whether you pass or fail the exam. I don't think that PLAB is a difficult exam, but having said that, not everyone who does PLAB pass the exam. So you need to know that it takes good preparation, being honest to yourself, and also luck, because sometimes, although what I can tell you is, having explored the question banks well, understood the concepts on these question banks well, being thorough, because sometimes you just might know it, but you don't remember. For example, something like, okay, what would you, well, forget the example. Yeah, so be true to yourself and stuff like that. So have a good revision plan for the days before the exam. So what I mean is, you may spend, no matter how long you spend studying for these exams, the last few days before the exams is crucial. You do your mocks, and then you will want to definitely revise all of this. So you need to be able to have a way in which you revise before your exam, so that all of these things are at the tip of your fingers, and you don't need to spend too much of time thinking for the answer. Because sometimes you may know the answer. That's what I felt. Sometimes you feel like you know the answer, but you may not remember it. So these are basic exam skills. I don't want to go. I'm sure all of you have done med school exams, and you will be doing exams. So these are simple things that helped me. I'm mentioning the obvious so that we're all on the same page and it's not missed out. Yes, so it doesn't matter if you have bad scores on your mock, because the point of doing your mock is to work on your mistakes, and it actually reveals the sections you're weak at. Like, for example, you may not be the greatest at your medical ethics, or you've like really not paid too much of attention to your psychiatric questions. So these things would come up when you do PLAB. Do the mocks, and you'll be able to assess yourself, work on your weaknesses, and hopefully when you do the exam, general things for any exam: go to the exam center early, be relaxed. There are a lot of people doing the exam together, so try to calm your nerves. Your basic approach to any exam counts here, and hopefully you guys pass PLAB 1. So once you pass PLAB 1, you move on to PLAB 2. So like I said before, passing PLAB 1 will allow you to book exams for PLAB 2. So as soon as you get your PLAB 1 score, you can always move forward and book PLAB 2. So this is also done on the GMC online account. And you should book, so if you're already in the UK and you plan to do your PLAB 2 soon after your PLAB 1, you can. But I'd like to speak about the prep time and preparation for PLAB 2 in my next slide. So I'll just introduce what PLAB 2 is for those who don't understand what it is, or sorry, who haven't heard about it. All right, so PLAB 2 is the second part of the GMC's PLAB exam and is an objective structured clinical exam, like you may be knowing it as the OSCE. It's made up of 18 scenarios, each lasting 8 minutes, and it aims to reflect the real life settings, including a mock consultation or an acute ward. So to put it in simple words, you'll be going into an exam center with 18 rooms, and in each room you will be given a task outside the room and 2 minutes to read it. In the task, you have to pick up where you are. You may be in the GP surgery, you may be in a A&E, that is accident and emergency. You may be in a urology ward, you may be in an obs and gynae department. So that's really important. That context is very important. And you get 2 minutes to read the question, understand, and literally get ready for the scenario. So there's 18, but during the pandemic, this number changed from 15 to 16 and so forth, but whatever it is, they will always make sure it's fair, and all the doctors are tested on a fair ground. Right, so I'm sorry, I forgot to mention in PLAB 1, you have 4 attempts to get through your PLAB 1 exam. I'm not very sure about what happens if you don't, because then you have to go back and prove that you've increased your medical knowledge and then take courses, and you may get another 5th attempt. So that if you don't pass PLAB 1 within the 4 attempts, then you're not eligible to enter the UK via the PLAB pathway. Just note that I'm not going to talk about the other pathways to enter UK in this webinar, because I'm not very sure about it, but just remember there are other ways like doing MRCP or other membership Royal College exams as well. But PLAB pathway, PLAB 1 gives you 4 maximum attempts. IELTS, there's a maximum number. They don't record the number of attempts you do IELTS or OET. It's just a matter of getting the proficiency and moving on. Same with PLAB 2, it's 4 attempts for each exam. 4 attempts of the exam, and if you don't make it in your 4th attempt, I believe you can negotiate for a 5th attempt. It's showing that you have increased your clinical skills, you've gained clinical experience, blah blah blah. And I just hope that it's not the case for any of you guys. Most people get through their 1st attempt. Actually, yeah, and then there's a number which gets to their 2nd, and that's it. There are people who do go to their 3rd attempt, but that's all okay, because these exams, there's a lot of things influencing your results and the way you do this exam. So you have to take all of this into consideration. So let me get back on track. PLAB 2 is £875. It's paid online via the GMC account after passing PLAB 1. Right, so where and when can I do PLAB? So PLAB 2 is held at the assessment center only in Manchester. So prior to the pandemic, there was just one center, but I believe recent times they have opened 2 assessment centers, which gives you more options. I believe it will continue to be the same, because as long as the pandemic is an issue, because there's been a huge backlog of candidates not being able to book PLAB 1 and PLAB 2 exams over the pandemic. I hope it's not the case for you guys. but yeah, I'm just letting you guys know. So again, PLAB 2 during the pandemic depended a lot on the availability of dates online, but generally PLAB 2 is available every single day of the week, Monday to Friday, and they happen in blocks. So it's more freely available than PLAB 1. So you shouldn't, in a non-pandemic ideal circumstances, you shouldn't have an issue booking your PLAB 2 exam. You can book for the exam as soon as you pass your PLAB 1, but you have to take into account where you are at that point in your journey. If you're in the UK, you can aim to book the exam in the next, obviously your financial circumstances, if you want to, how long you want to stay in the UK, where you are, the time it takes for you to process the visa. So this all takes planning, right? So you should make sure where you are, what you're going to do, and then book the exam. So I hope I'm making sense. If, sorry, I've come quite far. If you have and need me to clarify anything again, I'm happy to do it. I'm just going to go forward, but I'll come back to answer your questions and we can clarify from there on, right? Yes, let me just move on. So preparing for PLAB 2, I would highly recommend going through an academy, because unlike PLAB 1 is an MCQ paper-based exam, PLAB 2 is an OSCE exam, like I described before. So an academy would, in general, how do I say it, put you on the right track and make you waste less time. Because, so I'm not allowed to, or nobody's allowed to share the scenarios or questions that come out in the exam. That's something that we agree to, and we will be held against it if we do. So what academies essentially do is they give you things like scripts of possible scenarios that came in the past, or maybe possible scenarios that can come up. And they prepare you for different scenarios in different medical sections. For example, there are psychiatric scenarios, emergency scenarios, obs and gynae scenarios, a difficult colleague, a difficult patient, an angry patient, breaking bad news, discussion with family, discussing a medical report. So there are different scenarios which you would essentially come across when you work in the UK or for the NHS. So I just want to add on here that none of this is actually a waste, because if you're doing PLAB, it's probably because you want to at some point work in the UK, and it would definitely help you from the point you're doing IELTS to the time you do PLAB 1. PLAB 1 essentially gives you a really good idea of what you need to know as a FY2, Foundation Year 2, or a Foundation Year 2 doctor in the UK. PLAB 2 will assess your competency as a Foundation Year 2 doctor in the UK. And it will actually help you with the practice, because you are going to come across all these scenarios in real life. So, I mean, believe me or not, like when I've been working, I've actually come across most of these things that I learned for PLAB 2, and it actually helps for me to, understand, grasp the system and actually ask relevant questions. Because had I not done PLAB and maybe went directly from China to UK, I would really struggle, because it's the way things work in the UK and China are very different. The system is different. The way people communicate. So in general, I think you get the idea. It's just different, right? So getting back on track. So I think an academy will help you put on the right path. So I personally went to an academy in London, but there are which is one of these, which is basically you can do your own research. There's Dr. Swami, Common Station, Aspire, and Dr. Sampson. All of these are registered academies which literally help people go through PLAB 2, right? They prepare you for the exam, including conducting mocks. So the price in general for these academies are like £500 to £600. So I will be talking about this, but in general, you need to be able to practice with doctors, always cross-check with UK guidelines. The exam is available only in the UK. Sorry, the guidelines are usually available only in the UK. Like if you have any doubts, you can go through nice.org.uk or www.nhs.uk. If you have any doubts in how to explain a medical condition to a patient, how do I manage this patient, like lots of the time, I'm sure you guys, if you all are aware of how things work back in your country or in China, in the UK, there are like a lot of multidisciplinary teams that work together in patient care. So it would be helpful to know who to refer a patient to, how to make the referral, or who to talk to, what investigations should I take? Because these are standard practices here and everybody refers to these guidelines. So the academies make it very easy for students by just laying them all out. All we have to do is assimilate them, practice, do mocks, go for the exam. So yeah, I'll move on and I'll talk more in depth about PLAB 2, right? So the recommended prep time for PLAB 2 is about, I'd say 3 months. So usually these courses are full day courses that run from 10 to 14 days, depending on what academy you choose. They're very concise. So over the pandemic, I think this is also available before the pandemic, but now it's become increasingly common for people to do their first course online from wherever they are. I personally did it, although I was in the UK, I had to do my first session online because it was a lockdown and I couldn't get into the academy. Then it actually helped because doing it online gives you like a good, because at the end of the session, and it's sometimes very, how do you say, you can get really saturated because it's a lot of information, a lot of new things, especially for a young doctor who's not practiced before. Even I think people who practice before find it a bit difficult because it's long, strenuous sessions, but it's very rewarding because once you go through the entire 10-day course, you get a good understanding about what they expect, what to do for PLAB 2. So I won't go into depth about the syllabus for PLAB 2. I believe enrolling for these courses, there are a lot of things available online that can directly guide you through it. So the practice time after the course is very important. So there are people who've passed this exam with just 4 weeks of practice and some who recommend 12. So I think it depends. For me, it was very unideal circumstances where things were really, really complicated. So I didn't really have a lot of time after the course to practice, although because I attended the online course quite early, I had a good idea. So I did a lot of self-studying, self-reading, and I was mentally prepared to do the exam in a short time. And also I had like friends who did this exam, who guided me. So these all played a role in me passing this exam in one go. But it may and may not be the scenario for most people because everybody have their own experiences. Even if someone is guiding you through this, you still will come across your own obstacles, your own experiences, and your own challenges. I mean, you have to come across this. So just because it worked for one person doesn't mean it works for another. But in general, the more time you give yourself after your academy or your in-person course, the better chance you have at passing this exam because you're more confident, you're more prepared. So this exam, again, isn't difficult, but it takes a lot of preparation, mental agility, or what do you call that? Resilience. Like you need to be able to mentally be prepared for this exam because nobody is ready for this exam on day one. I haven't met anyone. So everybody goes through this process slowly and then they build confidence, build experience until they get there. So yeah, back on track, practice for 4 to 12 weeks. So all these things depend on your financial situation, whether you have family in the UK, are you staying alone? So you don't want to spend too much of time practicing because if you can't financially afford private accommodation for a really long time, for as long as 3 months, and I don't recommend it. You'd rather just practice at home, basically do the course online, practice with your colleagues or make online group practice over the, practice online, then I've known people who've come for the course and then done the exam within 10 days and just done a few days of practice on like mannequin. So there's a lot of ways you can do this exam. There's no ideal way to do it. As long as you're true to yourself, you feel confident, just go for it. Right, so the accommodation cost, if you don't have family here, would be roughly about $20 to $30 per day. You may find cheaper or more. You can maybe share accommodation. There's a lot of options. Like You can find them on Airbnb or, share rooms. It's never a problem. It's just that you need to know what you can afford, what you want, how long you want to spend, especially if you're working. You may not have all that time. So you may have to do a lot of the preparation from home and then come back and for a short time and go back. So all of this depends. That's why I can't give you a set plan. But these all, I hope you can take into consideration these things. You can take these things into consideration when you are preparing for PLAB 2. Right. Okay, so now coming to understanding the PLAB 2 exam. So PLAB 1, you will easily get to understand this exam when you do your question banks, because they're very well, I can't do a better job explaining it, because they're very well, they're focused on this exam. They help you pass. Obviously, there are people who have different experiences, but overall, for PLAB 1, having a good command of the concepts and understanding of the knowledge in the question banks will definitely help you pass the exam with a decent score. Having said that, there are times when I personally came across situations in PLAB 1 where I didn't know the answer. I haven't heard of it, but then you can get a wild guess. It's important to have that confidence. Like, don't get stuck with the question, answer it, move on, answer it, move on. If you don't know, don't waste time, because sometimes the easy questions are at the back, the easy questions are in the middle. So your aim for PLAB 1, after having prepared well, being mentally prepared for it, yes, is to finish the exam. Don't leave blanks. There might not be time for rechecking. So you do all of that. I think I spoke about it before. I'm just emphasizing it again. So this PLAB 2 is an entirely different ball game, because the exam is OSCE based, and you have you're assessed on 3 different aspects of your consultation. So to make things clear, it's bottom line. You're marked, every station is 12 points. 4 points are given for your data gathering, 4 points for how you manage this patient, and 4 points for your interpersonal skills. So to speak about data gathering. Now, for example, let me give you an example of a scenario, right? Well, this may not be the best, most organized, but I'm just going to give you guys an idea of what I'm talking about in terms of an example. So, for example, if a patient comes in with a fall, right? A patient comes to you, it depends where. So you have to make sure, is it coming to the A&E, coming to the GP, coming to, mostly A&E or GP. GP is general practice. That's the sector of the NHS as well, in case you guys didn't know. So the patient comes in with a fall. So the first thing you're supposed to do is data gathering. So things like, okay, so what brings you to the hospital today? What happened during the fall? What happened after the fall? Or what happened before the fall? Like, okay, did you lose consciousness? Like, did you have an episode of dizziness? Did you have chest palpitations? Did you black out? Then during the fall, do you remember what happened? Was anyone there around you? Did someone witness this fall? Then things like, did you hurt your head? Did you knock your head? Then after the fall would be, okay, what happened after? Who helped you up? How did you come here? Did you remember what happened? Do you still feel nauseous? Did you throw up? Did you injure yourself? So these are things you ask. Then it comes to data gathering when you are essentially ruling out all the differentials for your fall, this patient's fall. So before that, you would be like, is this the first time you fell? Have you ever fallen any time before? Like, if they say, yes, doctor, I fell like twice before, then you shouldn't ignore those. So these are data gathering. Okay, tell me about the first time you fell. Like, what happened when you fell the first time? Okay, they would say, I don't know, doctor, I just gardening, and I was standing for a really long time. So you say, when did they fall? How did they fall? Then the second time, when did you fall? Where did you fall? So you're literally, as a doctor, you're gathering all this data from the patient, to come to a good conclusion. So data gathering also includes their past medical history, right? Like, for example, how has your health been recently? Have you, anemia is one of the differentials for falls because they could be lightheaded, they could be breathless. So how have you been recently? So the patient might not always, tell you, yes, doctor, I've had lightheadedness and this, I was feeling tired. They would just not say anything. So you would be like, okay, when they don't give you, you give them the opportunity to you ask them an open question. So tell me more about it. They don't answer, you go for closed questions. So this PLAB 2 involves asking open questions and closed questions. So closed questions would involve, okay, you mentioned you fell twice before, but how has your recent health been? Like, how have you been coping? Have you been feeling tired? Have you had chest pain? What else? Have you had any weakness in your face? Like, you're ruling out things like stroke, any heart problems, like, asking closed questions like syncope, any palpitations. So sorry, guys, I'm not very organized, but I'm just giving you an idea of what data gathering is. So data gathering doesn't stop there. It goes from past medical history to social history, like who do you live with? Who's there to look after you? Do you live in a single-story house? Do you live in a double-story house? Do you have stairs? Do you have loose carpets? Are there any leaks? How has your vision been? Like, so basically you're ruling out things that, could have caused the fall, depending on where they fell or the risk of falling at home. Then, so medical conditions, have you ever been diagnosed with things like osteoporosis? Because, risk of falling can cause future fractures. They may not know it. Then you'll be like, doctor, what's osteoporosis? You might have to, you have had to explain what osteoporosis is. So you need to have a very focused, this is not the best consultation example, but I'm just giving you a good idea so that I can speak, continues on my next slides as well. So yeah, you're going to rule out any medications, any medical conditions. So have you ever been diagnosed with something called high blood pressure? Have you been have you been taking any medications? And they might be like, yes, doctor. So have you had any recent change in medications? So, all these questions add up to your data gathering. So this is, once you practice, you get like a good idea of what to ask, how to ask, when to ask. Mind you, it's within the 8-minute time frame. So this time management is important as well. So when all of this is done, you will also assess in the UK, it's very, in the UK, in practice anywhere in the world, it's also important to rule out non-accidental injuries. Like, have they been abused at home? Did anyone push them and that's how they fell? By any chance, like, how are things at home? Do you have any bruising? Like, do you have, because, people who've had constant bruises you want to know why they've been bruised. Is it because they have a bleeding disorder? Is it because they are being abused at home? So these are things as a doctor that you need to show that you're aware of, that you're ruling out. So all this comes under data gathering, right? Sorry, guys, it's been this is quite disorganized, but I'm just giving you guys an idea. So data gathering also includes the investigations you will be often order next. So you want to make sure there's no fractures. So you're going to do you can do basically in the UK, you can order a CT scan of the head, you can order x-rays to make sure there's no broken ribs, all of that, and then your general full blood counts to make sure there's no anemia. You can offer a clotting profile if you see that she's been bruising, just to make sure, and then make sure she's not on any blood thinning drugs. So all of these networks, in the first go, it's a lot in your mind, but when you practice, you eventually come, like you will have a good structure to find. You will build your own structure, or you will practice on a structure that you won't miss on any important keys. So so data gathering is this, plus not just the verbal cues, not just what the patient says, but also non-verbal cues. So things like, you may completely miss that the patient is holding on, or like, lying down at an angle because she might be having rib pain. She's finding it difficult to breathe. She might not say it, but you need to be able to pick it up. So all this come under data gathering, right? So management is how you essentially manage this patient. Once you've come to your differentials, then you should say, for example, in this scenario, say that this patient had, so the patient tells me or tells the doctor that she has had a change in recent medications. The last 3 times she fell because she's been standing for very long. The second time she fell because she was watching TV and she stood up, she felt dizzy and she fell. And this time she fell because she was very tired after gardening and she stood for a long time and she fell. So you're obviously everything points towards a condition called postural, say it points towards postural hypertension. And then this is also backed up by the fact that this patient has had a recent change in medication of her hypertensive drugs. So you have gathered this data through your data gathering, and now you have to tell the patient, look, I'm glad you come here today. So what I think what's going on with you is that you have a condition called postural hypertension. This is essentially something that happens when you change positions and you stand up, your blood pressure drops and the supply to your brain decreases and you essentially collapse. And that pretty much sums up what you've told me so far. But let me go forward and do some investigations for you. So you're managing the patient now. I'm going to order some blood tests for you, like full blood counts, urea and electrolytes. I noticed some bruises, so I'm going to order a clotting profile just to make sure. You mentioned that you don't take any other medication, but just to be sure, do you take any blood clotting drugs? So it doesn't matter where you ask it. Obviously, you can be more organized than I am now. It's been a while, but the more organized you are, the better. And then, so you manage this patient by saying, right, I'm going to ask, obviously you can review their blood pressure drugs if you want. I'm going to write to your GP about what happened and ask them to review your drugs. In the meantime, I would also like to order a DEXA scan. So that's a scan that is available to check if she's not diagnosed with osteoporosis. You can literally rule out the possibility, because if she falls in the future, you want to make sure she doesn't fracture herself. Her bone density is not too low. So as a doctor, there's a process you think, right? And obviously you don't have this as soon as you graduate from med school, because I don't believe you have it. Maybe you do, but I didn't have it. And so basically managing the patient is managing the medical condition, so in the meantime, I haven't spoken about interpersonal skills, right? So your interpersonal skills is generally how you speak to the patient, how empathetic you are, how kind you are to the patient. So you're going to ask this patient as they come in, are you particularly worried about anything? Did you have any idea as to why you're falling? Are you concerned about something? So they might be like, yes, doctor, I'm so, I've been falling a lot. I'm afraid that I'm going to fracture myself. Or doctor, there's this loose carpet in my house that, I feel like I might trip and I don't want to fall again. Or, they could come up with their personal issues. So all of these issues, the way you speak to the patient, the way you address their need, address their concerns, manage their expectations, it starts from the time you start the station. That is, as the minute you enter to the minute you end, your interpersonal skills need to be intact. From greeting the patient, good morning, how can I help you? What brings you in today? Thank you very much. I can see you're concerned. What's bothering you? To at the end, okay, I hope you're happy with this plan. I know you may have more questions. Please feel free to come back. I will write to your GP. So in general, you're managing the patient in a wholesome manner, not just the condition, but manage the patient as well, manage their emotions, manage their ideas, everything, okay? Forgive me if I'm not doing a very good job here, but this is just to give you guys a general idea of how to approach a station, how this exam works. And this is just one scenario. There are different scenarios like this. So let me finish. Yeah, so I think I've covered most of it. This is just to give you guys an idea of what I'm talking about, right? So the issue is you will come across a lot of scenarios from your academies. They will give you a bank of scenarios. They will give you a lot of resources that will be made available. It's up to you how to utilize it. So sometimes people have great interpersonal skills, like, they're really good at impressing, like saying, good morning, how are you? Is that all right with you? Do you want me to speak to your family? Are you okay? Like, things, you're just showing that you're a really good doctor who cares. You have to show that you're a good doctor who is safe. And you're aware of how to manage this patient. You are aware of the kind of referrals. You're aware when to escalate this patient. For example, like I mentioned, if the patient said, oh, doctor, I don't have help at home. I feel like I'm falling, I'm worried. So you can always refer this patient to social services. So all these things will be made available to you when you do your PLAB 2 exam. sorry, when you do your courses, there are a lot of resources. When you get into this, when you start working for PLAB, you will become aware of the services available. You'll be aware of the kind of options available, the management. So these are essentially not issues because you will come across them, although you may not have any of this right now, right? Right. So let me just move on from here. I hope it gives you a good idea of how this exam is assessed, right? So that's essentially data gathering, management, and interpersonal skills. And none of it is important than the other. It's important to make sure that you give, basically interpersonal skills doesn't take time because it's intact throughout your consultation. You take about, in the 8 minutes, you take about 4 minutes to 6 minutes to do your data gathering. Most people suggest 4 minutes, and then management would be 4 minutes because then you have time to address their concerns, ask if they have more questions, do referrals. So yeah, time management is key. Sorry, there's no magic way, or there's no magic in doing this. The only way forward is practicing, and the more you practice, the better you get, right? So I'm going to move forward. I think I've taken a long time here. So top tips for PLAB 2, like I've discussed this already, so I'm going to go over it. Be prepared and be consistent with your approach. So preparation is key, consistency is key. So there are times when people, like I mentioned, there are 18 stations, of which 2 are rest stations. So you get 2 breaks. So consistent with the approach, meaning you need to be able to be consistent. Like if you're saying you can't be nice in one station and then go back and what's the opposite of escalate? Decelerate throughout the station where you get tired and you don't give the same energy, the same concern and care to the patient. Practice is key. Top tip is be polite, show a lot of empathy and sympathy. I believe you'll come to know what it is if you don't know it. I'm sure all of you understand what empathy and sympathy is, but empathizing with the patient is putting yourself in their shoes, making them, showing them you get what they're going through. I can imagine what you're feeling like, not just saying, I'm sorry, I'm sorry, I'm sorry. I understand. Like, obviously these things are small things that you will come across when you essentially prepare for PLAB 2. I'm not going to go into depth. But just remember these things when you eventually do come into PLAB 2, because none of you guys have attempted the first part yet. So these are things that you will want to remember later, right? Do not be scripted. So what are the main things about PLAB 2 is there is a risk of being scripted because these academies can give you scripts out. And sometimes if and when you might just end up assuming things or taking things off the script, and you know the answers to the questions they're going to ask and you answer them before they ask. There have been scenarios that have happened because I don't personally know how the academies prepare their scripts. I'm not supposed to know. And I don't know how the GMC prepares their exams. That no matter what, there's a good chance of new questions and new scenarios coming up all the time. So it's important not to be scripted, but to always listen to the patient and answer with your own conscious and understanding. So that's something that you will have to remember. It's important to read the task carefully and don't assume anything. Mock exams definitely help because why I say it definitely helps because it gives you a good understanding of who you are in terms of how you react to stress. It gives you an understanding of how the stamina you have, because these mock exams most academies give you mock exams, which are ideal, which are technically similar to the exam, where you will go through like scenarios, the same number of stations with or without break stations, and you will know that at one point you become tired, you know how to it's a lot of self-awareness by going through mock exams, right? So it's important that you do them, and they're available via some people do it online, some people there are a lot of people who conduct mocks online these days because of the pandemic. So these are great for people who want to have an idea without going right into the academy. Academies do them as well. So essentially I highly recommend it because it kind of helps you with your nerves, and having known that you've survived 2 mocks, I think at least 2 mocks would give you a good idea of how you react to stress, the kind of things you missed out, your weaknesses. So mocks are very important in PLAB 1 and PLAB 2, right? And like I mentioned before, if you have any doubts in most of everything is given on a plate most of the time, but it's up to you to do your extra research. You can refer to the NHS website. NICE guidelines to clarify doubts on how to manage patients, etc. Right? It's also important in PLAB to have a approach, like a general approach to a station when you don't know what this scenario is about. So if you face a topic that you're unfamiliar with, you can build a rapport with the patient. So building a rapport essentially means you're gaining the patient's trust. Although these are simulations, they're very real. They're really good actors. They will, you just don't see a difference. Like after some time, you just don't see a difference because it's the same. They're in fact very animated. So you need to be able to build their trust, gain their trust by talking to them, speaking a bit, instead of just going into the station and being like, okay, why are you here? What can I do for you? This is the medication, move out. That's not the way. You need to be able to build a rapport, elaborate their concerns, eliminate any red flags, and finally tell the patient what you think and formulate a management. Right. So I believe I've discussed all of this, and I hope I've made my point through. Apologies if I haven't, because I'm not the most organized at the moment, but I just wanted to give this, the point is to give you guys an idea of what PLAB 2 is about, because most people don't really know what it is about, and they try to figure it out after PLAB 1. So this is just a general overview, right, with the example I gave you. So it's also, again, general tips. Obviously, you guys already might be knowing about this. So it's better to, in general, get to the exam location center a day early, relax, eat well, eat and sleep well. So the day before the exam is very crucial, because the amount of sleep you get, your nerves, they all depend on the amount of sleep. That's personally what I believe. So there's nothing much you can do because you've prepared. Like I told you, it would take you 4 to 12 weeks. And this is constant practice with other doctors. You can practice online, practice in person, so whatever. You've done all of that. And the day before the exam, you need to literally relax, obviously revise on things that you know you need revision for, but there's nothing much that can change, because this is generally your approach to a patient from here on. Like when you work in the NHS, you come across these patients every day, and these skills that you learn, these are skills, essentially skills. If you don't have them, you can build them, that you learn as you go, right? And it actually helps when you work, because I find myself using, or I may have had it, may not have had it. Now I have it. So I use it in day to day when I speak to a patient, speak to my colleagues, speak to the nurses. So these are all good things, like good things that you learn. And I think it helps you become a better doctor overall, a more wholesome one. So during the exam, it's important to know that just for your information, there are times when you feel you have messed up an exam or messed up a station, but you're not the one to judge. So I believe it's important for you to know, it's called housekeeping. Literally, you finish your station, just forget it, move to the next station. Never linger on the old, because lingering on the old can just mess up the entire trail. So it's important to learn how to get to it. That's where mocks help, because it will give you that discipline. Like I finished with it, don't think about it, move forward. So mocks really helped me do that. And you only give up or stop when you're done with all the stations. And personal experience, I guess you guys would want to know. Obviously, the first mock was very, very stressful. Like I think I was very stressed. But then once I did my first mock, I realized I can handle it. And I could remember, because until I did my mock, I didn't realize I could actually remember all the information that I have been grasping, because I practiced with a very good friend. But still, you never know. It's just a fear of the unknown. You don't know what you know. You don't know how capable you are until you get there. So it's definitely something that you have to go through. So I highly recommend mocks, whether it's online or in person, whatever. And anyway, once you enroll with these academies, they will prompt you to do it, and you will get a better understanding of this whole thing. So you only stop when you have attempted all the stations. And I was at my personal experience. The first mock was stress. I was obviously messed up, but the second mock went well. And the exam, having dealt with my personal fears and insecurities or nerves, helped me go through the final thing smooth. Even then, nothing can compare to compare real exam. What I'm trying to say is you can't compare the real exam to the mock, because you always will go through it. But once you get through your first two stations, you just forget about the exam, because you know what, you need to read process, go there, do your best, come out, go in. So I don't know where I saw it. I've been reading a lot of blogs. There are so many useful blogs out there. People have shared their experiences on Facebook. I'm really sorry, I haven't prepared the names of the blogs, but you can easily find them. Like, they're so freely available. People say, think of it as a game where you have 12 points in each station, and you want to collect as much as you can. So that really helps. Even if you mess up, it doesn't matter, because out of the 16 stations, I believe you need to pass 10 or 11. 15, if it's 15, it's 10. Yeah, out of 15, it's about, you need to pass 10 stations. If it's 16, it's 11 stations. So you can afford to fail. But the important thing is in PLAB is these things vary according to people, how students or doctors perform at the exam. But what I'm trying to say is that you need to have an total overall score that is above a set minimum, and a total number of stations that you have passed. So even if what I always tell people is, even if you're failing a station, like fail it with, if usually if the fail mark is above 5 or 6, fail it with a 5. So you can always gain marks, even if you are data gathering. If you have no idea about what it is, you can still pass the exam if you have done a good a very fair data gathering, a very fair management, or at least you've escalated this patient and made sure you're safe. So more on this, there's a lot about this. I'm not going to go in detail, but in general, yeah, you can pass, and it's good to like, well, again, I lost my trail of thought, so I'm just going to go back to the next next slide, right? Sorry about that. Right, so 2 minutes before entering the station is very precious. Always read the questions carefully. So if there are clues, like in terms of timing, age, gender, and location, you can build your differentials, rule out red flags. So red flags, I'm sure if you guys know, but if you don't, it's things that the patient needs to look out for. Like, for example, in a patient who keeps constantly falling, you want to warn them that a red flag for constant falls is if you have any chest pain, any palpitations, so you're going to rule out atrial, arrhythmias, you're going to rule out blackouts or a stroke, like any weakness, things that the patient needs to be aware of, the other people need to be aware of, and that needs emergent medical attention. So these are essentially red flags, and also you will safety net accordingly. So safety netting is letting them know and making sure that they're safe, right? So more on that another time. And you plan the management. Right, so fine. So I've spoken a lot about PLAB 2. I hope that you guys get an idea of what this is about, what the exam is. That's PLAB 1, PLAB 2. So EPIC verification is essentially, I'm not going to go into details, because again, this is a basic process where you go on this website, it will lead you through it. You upload your primary medical qualification or your diploma, and literally this is a verifying body online, I believe, which will contact your awarding body to confirm that your certification is legit. So this is something that you do before you would need this by the time you have your GMC registration, but you can start this process just after you've done PLAB 1. You can do it just after PLAB 2. It is independent of the PLAB journey, but you need this at some point ready when you are going to register with the GMC. So this is something that they require during your GMC registration, right? So the costs to establish the account, it's $130. To verify your credential is $100. And if you want basically a certificate courier, there are some subsidiary expenses for those. So this is something that is a part of the journey, but doesn't directly involve the PLAB journey itself, right? So GMC registration. So finally, once you're eligible to apply and fill in your application for GMC registration, once you've passed your PLAB 2. So PLAB 2 results take roughly 4 to 6 weeks to come. So once you've passed, hopefully when you guys do, you'll all pass, and it's a really good feeling. You can start the application for your GMC registration. You just go on the GMC account and then you will start your registration. Essentially, I'm not going to go into details because it's just too much at this point. They're very self-explanatory, very easy. You just you start the process, make the registration fee of £153 for someone who's already done their internship. So you're going to go for full registration. So a quick talk about full and provisional registration is, so provisional registration is for those who have graduated but not done their internship. They haven't practiced medicine, and essentially it's something given, and you're eligible to start as an F1, or you can go through the internship process here. Full registration is for someone who's completed 1 year of practice after med school. So the prices differ. I don't want to go into details about this because it's pretty self-explanatory. You just need to know that you're going to make a payment, start the GMC process, where they will ask you for certain information. So I think it's worth noting that you will need your IELTS certificate to be sent. Basically, it's scanned. In the past, it used to be bring it over or send them by post, but now it's all online. So you send them the IELTS certificate, you send them your the degree certificate that you got verified by EPIC. You will also give them your EPIC reference numbers. Now for me, it was pretty straightforward. I got my GMC registration within 10 days because I did not hold a medical license in any other country, right? I was not registered doctor in Sri Lanka, nor was I in the UK. Nor was I in China. So it was pretty straightforward, but this can be a little different for those who are practicing in a different country, who hold a medical license. Then I'm not sure of the process, but I've heard that they will there's something called a GEN form that you have to fill and get your hospital to fill. And that clarification takes a while. So as long as your application is over let me add something else. As long as your application is smooth, you can get your GMC registration like within 10 days. One more thing that's worth noting is when you fill in your GMC registration, they would want to know what you've been doing in the past 5 years. So it's also important to not have any gaps. Like, for example, for me, I've heard people who've come across problems or delays because they've been asked to clarify if you leave gaps. So for example, say I graduated from NMU in 2019, June. And I said June 2019 to October 2019, preparing for IELTS. October, whatever day, 2019 to March 2019, I said preparing for PLAB 1. March 2020 to December 2020, preparing for PLAB 2. You can choose, they say you can add things like holidays, because I didn't have anything else happening because it was during the pandemic. So I had to kind of I was back and forth. I think I did mention, anyway, as long as you don't leave any gaps, your registration is smooth and you should get back. If they have any queries, they will always ask you about it and you can always sort it out and it will eventually be successful. So yes, the GMC registration is pretty straightforward. You can cross the bridge when it comes, so you don't have to worry too much now, especially because most of you guys haven't attempted PLAB 1 or you're still in your first, second, third years. This is just for you to have an idea of the process, right? So we're done with GMC registration. Now it's up to applying for jobs. Again, I'm not going to go into too much detail, but applying for jobs would mean applying on NHS. You have two main websites. There's NHS Jobs and Track Jobs. If you do a Google search, you will be able to easily get information on this. You make an account on it and you can start applying for jobs. So once you make a successful application, well, that's a talk for a different time, I believe, or I will maybe update you guys on my Instagram blog. You apply for jobs. Once you make a successful application, you will be called for interviews. So if you guys would like to know, interviews in the past, usually most of the time happened in person. I've been to in-person interviews as well as interviews online. So most interviews nowadays happen online. So I think they might just call it back to being, I mean, they would just bring it to being online because it's very much easier, because you don't have to come, or if you're in a different country at the time of your interview, it shouldn't be a problem. That's what I'm trying to say. So once you get through your job applications and your interviews, a successful interview will lead you to a job offer in the NHS. And you can technically, so again, job offer in the NHS may not include, but what I'm trying to say is they will sort your visa out, like your tier 2 sponsorship, if you need it. For example, I needed it, but there are people who maybe are already British citizens or married to people in the UK, or they are already here on a whatever, all sorts. They don't need it, then you don't need it. But if you need it, the NHS personally will sponsor you and give you certificates of sponsorship to apply for your visa, and you get to start working at the NHS. Right, so that's about it. I am hoping that it made sense, and I'm sure y'all have a lot of questions. Yes, so let's get to the question and answer section, Prashant.
Right. All right. So we actually, okay, so I was in charge of sorting out the questions, and I ran into a bit of trouble, but we have a lot of questions, right? We have a lot of questions, so I will ask them in the order that they came out in. Sure. All right, so the first one we got was, what can we do if we've already done postgraduate and then want to go to the UK?
So if you've done your graduates in a different country, so yeah, that's actually, okay, this is not my personal experience, but I'm just, y'all can always verify with other doctors, but what I've heard is actually great, because, you know, it adds, like I mentioned on job applications, having done your postgraduates gives you extra time. So you can technically apply for a job that fits your experience. So for example, if you want to work in the, like, depending on what career you're choosing, career path, you can easily apply for a non-training job. And I think having done post-graduation is a plus and not a minus. So it's the same process. If it's through PLAB, you can still do your PLAB 1, PLAB 2, register with the GMC. On your job application, they would technically ask you for any qualifications extra. So that would, I think, add an extra on your CV. And for example, I would apply for F1 and F2 jobs, but if you're someone who's had more than 1 year of experience, you can go for like a more higher paid or higher demanding trainee or a co-trainee, a CT level non-trainee job. So training in the UK is a different process, but yeah, I hope that answers the question.
Right, yeah. Okay, so the next one, apart from availability, is there any difference in level of difficulty when it comes to OET versus IELTS?
Yes, so I think the general consensus is that IELTS is slightly more difficult than OET because of the range of topics you need to talk about. For example, when I did my IELTS exam, I had to speak about urbanization and industrialization and all of that. So you need to have a higher command of English to be able to express yourself. So that's that. So the thing is this: the English is not, obviously you can speak and communicate, you can still survive in the NHS, but you're writing, so it's a skill. So most people think that OET is a little bit less complicated in that way, because you're just speaking of medical stuff. Patient came with acute kidney injury, I transfer this to the GP, blah, blah, blah. So all medical context. So it's actually on your preference. It's just that availability is one thing, but then you can consider the price. Some people think OET is a one-time thing. You pay £320 or whatever, get it done. Most people have got through OET in one go, whereas IELTS people have had to do it multiple times. So difficulty, I think you should assess for yourself depending on your language proficiency. So be true to yourself. If you feel like IELTS is not for you, I think the best way to do is do past papers and get it corrected, or you can have a go if you have the financial flexibility to do so. If not, go for OET because it's, I think, more predictable. You same thing, but I've read from what people have shared with their experiences that even OET people don't make it sometimes because they don't practice or give the attention that it requires. So yes.
Right.
So to answer the question in brief, difficulty, I believe IELTS can be difficult if you are not the most proficient in reading, writing, speaking, and listening. So I think most of the time it's writing. So if you're not a proficient writer and you're better at writing at medical stuff, then go for OET. Yeah.
Right. Okay. Okay. So we have another question. So several students send this, so I'm going to just group it all together.
Right.
A lot of students want to know when the expiration would be for the IELTS and the PLAB 1 results. So that's the time periods, you know.
Good. So good question. Sorry, guys, I should have mentioned it. So IELTS expiration in general, pre-pandemic, 2 years. PLAB 1 expiration pre-pandemic, 2 years. So I would say 2 years. PLAB 2, the time between PLAB 2 and GMC registration is 2 years. It is all pre-pandemic, but with the pandemic, they have made it 3 years. So I still suggest stick to 2. If there are unexpected exceptional circumstances, if this pandemic does go on for the next 2 years, then I believe it would still be 3 years, because at this point it's 3 years. You have to finish, if I'm making sense, you have to finish PLAB 1 and PLAB 2 before you, PLAB 1 and PLAB 2 within 2 years of doing your IELTS, because IELTS matters when it comes to registering with the GMC. So IELTS need to be still valid at the time submitting your GMC application. In recent times, they have given excuses to people because of the pandemic, and they have increased the validity to 3 years, but safe to say 2 years. Right. Next question.
Right. Okay. So the next one is a bit subjective. My spoken English is not very good. Are they very strict about good language skills in general, apart from proper history taking skills in PLAB 2?
No, so PLAB 2, I have seen people with the if your spoken English, I mean, don't worry about it, because you will, you should worry about it, but you should just know and believe that it's a skill. And, like when we, as kids, we always improve. If you focus on improving the skill, you will improve. But coming to PLAB 2, I believe, yes, it does play a role, but no, I have seen people with very average, like as long as you can communicate and you're doing the right things, you're doing the right data gathering, you're doing the right management and interpersonal skills, your language shouldn't matter, because you will, as long as you can express yourself, right? Because that will matter when you were working in the UK as well, because you need to be able to express yourself. That will obviously be a disadvantage, but it shouldn't cost you to fail if you practice and practice focused on the exam, if that makes sense. Yeah, it shouldn't matter. But obviously, it will be an advantage if your language skills are better. Right.
Right. Okay, so how is your experience at the workplace in general after passing PLAB? Do they treat foreign graduates differently or rudely?
No, not at all. Honestly, not at all. Like, they're really supportive, and so I've only been here for 2 months, so I can say from the experience, like when they ask where you're from, I say I'm from China, I'm Sri Lankan, but I graduated in China. It's more of a wow instead of a it's more of a wow, because like, oh, so you learned Mandarin, you survived there, or like, wow, how did you do it? Like, it's more of a plus than a negative, because here they don't, like, everybody is very keen on teaching you. And if you don't know something, they appreciate it when you say, I'm sorry, I don't know, but I want to know. So that culture exists here. So they don't bully you when you don't know. So they will be like, so basically so answering your question, no, they haven't, no, they don't treat you differently. Also, it depends on your attitude and what you expect. Like, you can't expect them to, if you go in with no expectations, they respect you. They value your input to the system. As long as you do your job and you are honest and you're prompt, they actually value the journey that you've taken. Like, I had a consultant who's like said, I think they will call us international medical graduates have gone through a lot to come here, and then hats off to you guys, because they think, because most of the, I'm not putting them, I mean, I think the UK grads are amazing, but they also appreciate the fact that we've gone through all of this to come here. So it's really nice to have them appreciate you. And I've heard them say it out loud. So I'm like, yeah, it's really motivating. So no, not at all. They don't treat you differently. Just to add to that, like I'm a non-trainee, but still I technically have my own clinical supervisor, my educational supervisor, and I do work on my own portfolio, which will help me if I am and when I am applying for a training program in the future. They have the same things as well. So no, we don't get discriminated. And having said that, there's always different people. So you need to be prepared for, you know, you need to be open to anything. But no, in general, if that happens, you can always raise it up. Right, next question.
In PLAB 2, are we also supposed to perform physical examinations within the 8 minutes period?
Yes. So what I discussed with you is a history-based station. There are different types: history-based, there's teaching stations, there's also physical exam-oriented stations, where general rule is, if it's a physical exam station, when you usually walk in, you would see a mannequin or a person. If you have to do it, yes, you have to do it within, you take about 2 minutes to do your physical exam, but you will cut the history short, because you will know that, in general, when you practice, you will know if this will lead to a physical exam or not. And then you will cut your history and do a more focused history, do your physical exam, then come to management. Yes, you will need physical exams as well. Yeah, you will have to do physical exam.
Right. Is there any need to do internship despite passing PLAB 1 and 2 to get into the NHS?
Is there a need to do an internship despite?
So basically, I think they're asking about the provisional GMC registration via the F1.
Right. So guys, I can just give you an idea about it because I am not very thorough. But what there's an option where you can do, basically, you can do PLAB 1, like I mentioned before. You can do PLAB 1 if you have your like the 3 criteria I mentioned, the acceptable medical qualification. So once you do PLAB 1 and PLAB 2 and you don't have an internship, that is the only time when you can apply to the UK FPO. Just read up on it. If you go online and type UK FPO, it's a UK foundation program. There is a deadline and a start date, blah, blah, blah. You can apply to their program and go through their internship, the UK graduate internship. But I don't know too much about it. It's something that you all can research about. So to answer the question, yeah, if you don't have an internship, so I know some people, even Sri Lankans, who have graduated from a university, done their PLAB 1, PLAB 2, done their internship back in Sri Lanka, and then are now coming back to the UK. No, so basically PLAB 1, PLAB 2, graduation, no internship, PLAB 1, PLAB 2, then GMC registered, but provisionally, then internship Sri Lanka, come back to UK for, hoping to go to UK with applying for jobs. So that's that I've heard of. You can always research on the UK Foundation program. There are timelines, deadlines, there are a lot of other requirements. So what I did was the easiest way in, I believe. But a lot of people have done what you are what you're asking me, like what you just questioned about. Yeah, the people have done that. Like they've done PLAB 1, PLAB 2, and either choose to do internship in the UK, that's their F1 year in the UK, or they've done their F1 year, which is the first year after graduating elsewhere, like wherever you are, maybe India, Sri Lanka, you can do that as well. So there are lots of options. This is just my journey. Yeah. Right.
And then we have a little bit of a more up-to-date sort of question, where we actually got 2 students asking about the current pandemic situation and their online study. Will they be accepted by the GMC? Which is, I'm not sure if we can directly answer that.
Yeah, actually, I've read up about it because I'm close to this topic. I mean, it's been close to me as well. So what I think, guys, is that, see, the guidelines about online study, I think they say that if not for exceptional circumstances, you can't do a percentage of your university studies outside of your primary or mother university, right? But right now is exceptional circumstances. So when the time you have to, like, I believe when people have emailed JMC and asked about their online study, you can always do it. If you haven't, they have given like an old guideline. But if people start questioning this, because, you know, they get it, like even the UK grads, like I meet them because I meet them at work, they've never had placements. Most of their placements were online. They did online studying as well. So I don't think, personally, this is just what I think, I don't think they will penalize or just exclude foreign graduates from this rule because it is not your fault and it's a pandemic that's causing it. So they will definitely consider. It's just that nobody has crossed that bridge yet. So again, if you guys want to like find out, you all can. But I think they should consider it. Like, I think they will not have an issue because you all have clear, especially those from China, you all have clear evidence to show that you all couldn't go back, and that's why you're doing it online. And that's all fair reasons. It doesn't mean that you have to waste another entire year to go and like redo all these online subjects, because I think even the UK grads had them online. So I don't personally, this is me, personally see a reason why they should exclude foreign graduates, because usually they're fair like that. Unless even if there is an issue, you can always raise it up and maybe there could be something that could be done about it. So yeah, so in short, I don't think so. But having said that, best is to confirm from them, because at the end of the day, they decide. I hope that it doesn't, because I think it would be very unfair. So that's just my personal opinion. Yeah.
All right. So we will take these, the last two questions. Right. The first one is, UK MLA going to be the same as PLAB? I heard that UK MLA will replace PLAB in 2024. How different it will be from PLAB? Do you have any idea?
Yeah, so well, I've read about that as well. So in short, I think what I've understood so far is now the UK grads have their own system of getting GMC registration versus the foreign grads have our own system. So what they're essentially trying to do is make a standard where the UK grads and the foreign grads will essentially go through the same exam. So there is nothing that's going to change. I think the UK grads will do the same MCQ-based test and the same OSCE exam. So it will essentially be the same, just the term to unite these two is UK MLA. And I don't think it should be very much different. The basic concept questions, syllabus, like the general clinical, the PLAB is very clinically oriented, so they will still keep the theme. They will still keep it intact. That's what I personally feel. It shouldn't be an issue. But even if it is, you will always have a lot of resources and you can use the same resources at PLAB. And they will consider that this is your first attempt. I mean, when they do transition, they will generally make resources available. So in terms of that, I trust that it will happen. So yeah, if good that you're thinking ahead, because it's something that you need to consider. Yeah, so I'm sure when it happens, you will have enough resources. It would be what I've read is it would be very much similar to PLAB. Yes.
Right. And the last question for the evening, guys, don't worry. I know we are getting many more questions, but we will put Dr. Delyse's contact information so you can directly contact her later. The last question, will there be a problem if there's a gap between your academic and internship years?
Academic and internship years.
So I'm assuming it's for students who studied, I think this particular student is from China, so they finished their 5 years, but they couldn't do the internship because of the COVID situation, right? I think.
No. So basically, I know the reverse of it, where there have been people who've started working in the UK after at least 9 years of gap, either because of family commitments, they built a home, you can just say homemaking, whatever. They've also considered these things. So they have literally graduated 9 years ago, did their internship, and they haven't worked for 9 years, but you have to show what you've been doing. So I suggest that after 5th year, until you get your internship done, like have evidence of things that you have been doing in case, but they should, as long as you rationalize what you've been doing, because you will have to do it when you get your GMC registration. So pandemic is a good cause, but keep your medical knowledge intact. If you can get attachments done or medical courses, so you can always say studying for PLAB 1, like anything. I believe it shouldn't be an issue. No. Again, to make sure you verify this, you can always, again, just for yourself, and don't take what I say for like as the word, because I haven't been through this. This is what I feel is right. So you should just email the GMC and just check, I have a gap. Do you think it would be an issue? Because the UK grads and the European grads used to have issues, but like I think these guidelines are not updated since the pandemic. Like things are constantly evolving. So yeah, it shouldn't be an issue because it's not your fault. So don't like worry about it too much.
Right. All right. So let's wrap up the session tonight. And before I forget, right, you can always contact any of us here at Medicine 101 or Dr. Delysze herself, right? The contact information is provided in the chat box. So we hope you all found the session useful, right? And that you all gained something out of it today. And thank you very much, Dr. Delysze, for coming in today amidst your busy schedule, right? For educating us and sharing your experience, right? All your personal notes. It was very helpful. All right, guys, that's about it for tonight. We'll hope to see you in a future session, right? I'm Prashant signing off for Medicine 101. Thank you for joining us. Good night and stay safe.
Thank you so much.
Bye. Thank you, guys.